Hi, I'm Isabella Galichia,
And I'm Dr. Jody Galichia.
and in today's video, we're going to be talking about women and their risk of heart disease.
Well, it used to be felt that women didn't have heart attacks and you didn't have to worry about heart disease if you were a woman. That was a long time ago because what's happened is that heart disease is the leading cause of death in women. And as a matter of fact, women live longer than men by an average of 3 or 4 years. And as they age during this period of time, their heart attack risk goes up. So, ironically, about the same number of women proportionally die of heart attacks as men. So these are things that happen, and women have to take care of themselves. They have to be aware of their risk. They have to know what their cholesterol is, what their blood pressure is. Same thing that men have to know about. And eating right and getting enough rest and not smoking is important. Now, here's something very interesting. After World War II, many women started smoking. And so there was a period of time when smoking was common for everybody. Men smoked, women smoked. If you look at an old movie from the 50s, everybody smoked, including women. So one thing that's happened here is that smoking has gone down. People really understand the risk of that. And women, more likely than men, have stopped smoking. So that has helped decrease the risk for women and men of heart attacks related to that one particular risk factor. Now, it's important that women understand the other risk factors, diabetes and high blood pressure and obesity and getting enough rest. That's really hard. It's always said that a woman's work is never done. And there's a truth to that because often when women get home from their job, if they have a job, then they have another job, taking care of the kids, cooking, taking care of everybody before they go to bed. For men, a lot of times it's a little bit easier. Come home from work, check the news, have dinner that's prepared maybe by your wife. So the stress on women has increased over the years, and more women have a job, they work, but then they have a job at home. So stress contributes to the incidence of heart disease in women.
So, if I had a family friend or a loved one who was a woman and was recently diagnosed with heart disease, what would be some of the questions that I should tell them to ask their doctor?
Well, one question would be why and what were my risk factors that led to this? Do I need to lose weight? Do I have diabetes? Do I need to check my blood pressure more often? Do I need to change my diet? Are there medications that I can take now that would help me slow this process down? In other words, I don't want to have a blocked artery that's completely blocked and causes me to have a heart attack. If you know that I have this kind of problem, what can I do? In other words, heart disease, slow it down. And there are lots of medications today that help both men and women to decrease cholesterol and to diminish the progress of blocked arteries and heart disease. And then I think the other thing is, there's one more very important thing, and that is that women often have different symptoms of a heart attack than men. Men often have what I call the Hollywood heart attack. They're crunching their chest, they're bent over, they have extreme pain. Pain radiates usually to the left arm. They're sweating. And those are the symptoms, that constellation of symptoms. But women, interestingly, often may have more minor chest pain. And they may have only one symptom. They may have just like sweating or weakness or a feeling of impending doom and not have as much chest pain. Or they may have pain that isn't so severe they would recognize it as a heart attack. So the symptoms are more subtle in women, and they're definitely symptoms that women need to understand because if they start having those kind of symptoms, they need help. Not so long ago, I saw a woman who said, I woke up in the middle of the night in a hotel and I was soaking wet. And I remembered listening to you on the radio, and you said, sweating may be the only symptom that a woman has of heart attacks. So she said, I told my husband, I think I'm having a heart attack. And he said, do you have chest pain? And she said, no, I don't have much chest pain. He says, just go back to sleep. But you know what she did? She called 911 because she said, I'd also just feel tired and I'm sweating for no good reason. And when the ambulance arrived, her heart had just stopped. They shocked it back to normal, and she had a normal outcome. So knowing that these symptoms are different and that they may be isolated is really important. That would have been a very unusual situation for a man. But for this woman, it saved her life, knowing that.
Thanks, doctor, and thank you for watching. And be sure to visit hearthealthcommunity.com to learn more about women and the risk of heart disease.
Thank you.